Okay. The we had a little bit of technical difficulties. Um, this is the agenda. We'll have the welcome, housekeeping, announcements, resources, events, any updates from communicable diseases. We're going to be talking about the Cook County, a brief presentation from our one of our staff members, Amy O'Rourke, for the Cook County Safe Travel for All. We also have the organization Mobile Care Foundation. They will be presenting briefly, and then Sea Life Freedom is the another presenter, and then we have adjournment. Okay, for those of you who are the first time joining the school health meeting, welcome. What is a school health meeting? A little bit about it. It's a community of learning where administrators and staff from schools, along with the daycares in suburban Cook County, get the latest guidance on preventing the spread of infectious diseases, receive valuable resources and tools, and discuss everyday strategies to ensure the safety and health of staff, students, and their families. The objectives is to stay informed, get the most up-to-date information and guidance to navigate issues related to health and wellness, resource sharing, access valuable tools, resources, and events in our communities, community support, connect with peers to keep your staff, students, and families safe and healthy. Housekeeping rules, a little bit of housekeeping rules. Please let us know if you have any specific access needs, transcription, etc. Please keep your line muted. Feel free to put any questions in the chat. Our webinars will be recorded. Announcements. Okay, Kelly. I do apologize. I forgot to introduce myself. I'm Stacy, one of the colleagues of the staff members of CCDPH. I'm Kelly Jones's colleague. I will be. I'm the interim temporarily till Kelly is back. Okay. Okay. So at the next announcement. So the next. Sorry, give me one second. Can everyone hear me?
Yeah, you sound good. That was gone.
Can you guys hear me? Okay. Okay. This is the announcements. Cook County invites the public to provide input on draft on the first ever environmental justice policy. Those who live or work in Cook County are encouraged to review the draft. And it's available on the DES website until February 7th until midnight. They will be having in-person town hall meetings. You can register. There's the link. The link will be in the chat. If you want to learn more information, please visit the cookcounty.illinois.gov. The link is will be in the chat. The contact information for CCDPH um, the webinar related questions, please email the Healthy Cook at cookcountyhhs.org. Reporting community lines list reporting communicable diseases, metric questions. You can go to CCDPH. The email address is right there. The website, please visit our website, and then our school health page. Any asthma or allergy resources for Suburban Cook, you can visit those links. The links are the in the chat. Next slide. Resources about the asthma and allergy for Suburban Cook. What's new? The additional resources is a new online school request form. So you can go to that link for the school request form. Submit any all questions to the new email address to that address that's listed on here. Any naloxone requests, please contact our opioid health educator, Denise Holman. Her email address is here, and there's the naloxone request form. It is also on the website, the school web page. CCPD nursing division health hearing and screening program has restarted. That is also on our website on the school health page. We're having our the COVID-19 and flu vaccination clinics are still going on. That will be continuing until February. So the dates and the locations are on our website as well. We have mental health resources. There's an adult mental health first aid done by Rincon. You can contact the information. The link is in the information to the contact person is in the chat. The next one is mental health services for youth by Saratoga Center Community. They provide mental health services for the youth. So you can the information is on the slide. If you would like to contact them for more information. We announced the scholarship for Matson residents for the Mark Zelinsky Memorial Scholarship. This is for anyone interested in a career. High school students interested in a career in the fire service department. You can the deadline to submit an application is March 21st. The information to apply, how to apply, is in the chat. You can email the address, and it's in the chat. A grant funding opportunity for schools from the U.S. Department of Agriculture. This is through the Illinois State Board of Education. This provides this is for eligible school food authorities up to $25,000 to purchase or renovate, refurbish equipment that the school's cafeterias use. So the deadline for the application to submit is January 23rd. So at 4 p.m. So the link is in the chat to how to apply. Another grant funding opportunities is with the Homeland Security. They have several opportunities for funding on funding for with different resources for targeted violence and terrorism. The link is in the chat for the more opportunities about grant funding for the Homeland Security. There's another scholarship opportunity for the George Pullman Educational Foundation. This they select the Pullman Educational Foundation selects high school seniors across Cook County for college scholarships. The application deadline is at the end of the month, which is January 31st. So to apply, please visit, the link is in the chat. Please visit pullmanfoundation.org. Another program that's going on is the Youth for Ward, a Positive Youth Development Program. That information you can contact the Kelly Warner or Bob Clasby for more information about that. The Respiratory Health Association is doing e-cigarette and vaping presentations for schools. If you would like to a program for them to come out to present, you can contact the person. This information will be also in our the school newsletter. You can you can contact the particular that person who's for that program if you want them to come out. And then like I said, it will be in the school newsletter. The youth action board, a chance for your voice to be heard. This is another program for youth. They're seeking teens ages 13 through 18 who want to make a difference in the community. You can contact Bob Clasby and to apply. There is a QR code for that. Another Youth Violence Prevention Council. They're looking for youths to join the council. You can this is done by the Empowerment Center, so you can contact them. Their information is on the flyer. We've shared this UIC Free Your Mind. Illinois residents whose family earn less, whose family earns 75,000 or less, could be eligible for free tuition starting fall of 2025. Apply now. I believe the deadline is in March to apply. Summer programs for high school students. This is for from the University of Illinois and also the University of Chicago. Both deadlines for the applications is this Monday, January 20th. So make sure they submit their applications by that time. The Greater Chicago Food and the Chicago Heights Public Library is hosting a supper and snack program. This is Monday through Friday, 2 to 4:30 p.m. for those individuals who for Chicago Heights residents. The Illinois Youth Tobacco Survey, that will be the deadline for the remaining schools to submit is this month, the end of this month, the 31st. So if you have not submitted the survey, please do so by the 31st of this month. Varsity Tutors, this is another program for youth. You can contact Kevin Brown, and the email address is on the slide to contact for this program. Illinois Department of Public Health has resources for adolescent suicide. You can visit the Illinois Department of Public Health for more information. Now we're into the events. There is a mental health and wellness fair that's coming up this Wednesday on January 22nd at the Lyons Township High School North Campus. To register, it's on Eventbrite. The link is in the chat. There's another there's a mental health youth mental health first aid training. This is going to be at the Bridgeview Library on January 31st. And you can register, the QR code is there. You can register for that on today. There is a 7th annual youth summit hosted by the Chicago Urban League. This summit, they have this summit every year. This is for Chicagoland students throughout Cook County. They're calling for high school administrators, and then the middle school registration is closed, but it's still open to the high school students. It will be held at the Tinley Park Convention Center on February 20th. So register today. And now we can go to communicable disease. There are no updates, but if you have any questions, Michelle's is on. Michelle, if you have any questions, please address them to Michelle. Who's on? Michelle, do you want to share anything?
No, we do not have any updates at this time. Hello? Sorry.
She's gonna come off mute. She needs to come off mute. Just let her. Okay. No. Okay. Thank you, Michelle. Okay, on to the next slide. We have Amy O'Rourke who will be presenting on the Cook County Safety Action Plan.
Great, thanks so much, Stacy. Hi, everyone. My name's Amy O'Rourke, as Stacy said. I'm the Director of Chronic Disease Prevention and Control at Cook County Department of Public Health. And I wanted to talk to you a little bit about the Safety Action Plan that's happening at the county level and the support we need from you all, schools, the individuals that live, work, play in suburban Cook County or in Cook County, including the city of Chicago at large, to participate in this plan. So we at the Cook County Department of Public Health, we've been working with the Chicago Metropolitan Agency on Planning and the Cook County Department of Transportation and Highway on the development of the Cook County Safety Action Plan. And this is part of a regional or a region-wide initiative called Safe Travel for All. This initiative really aims to reduce and eliminate serious injuries and deaths in northeastern Illinois roads. And so, with an emphasis on Cook County, our region, whether you drive, bike, walk, or use public transit, again, we would like to hear from you. And I'm going to share later on in the slides some ways that you can provide your insight into traffic safety issues in your community or the communities that you work, live, or play. Next slide, please, Stacy. Okay, great. So again, we've been working with a variety of different stakeholders and partners, implementing something called the Safe Travel for All. This type of planning that's happening in the county will, once we develop this plan with your input and your insights, once we develop this plan, it will give municipalities across our Cook County region opportunities to access federal grants to implement some of the safeguards, strategies, policies, resources that we're going to outline in this plan. They can actually implement it at a local level. So we're collaborating with a variety of different partners. And as I mentioned, there's an opportunity for us to collect some critical information from you all and other county residents to help inform the work. And next slide, please. So why are we here and why are we talking about a Cook County Safety Action Plan? Next step, or next slide. Thank you. even though total crashes are somewhat flat, fatalities are going up based on vehicle miles traveled. Can you advance to the next slide? I'm not seeing it on my end. Maybe are you seeing a graph on your end? Oh, thank you. Thanks. You are advancing. I wasn't seeing it on my end. I'm sorry, I updated my computer. So again, as I mentioned, fatalities are going up even though total crashes are staying relatively flat. Deadly crashes have surged 52% over the last several years. Next slide. And bike and pedestrian crashes are only 2% of all crashes, but they're 23% of fatal and serious injuries. And really at the core of this work is we realize that not all fatalities impact all communities in Cook County equally. You can see in this graph, unfortunately, we're seeing that traffic-related fatalities are higher, almost 2 times or more than 2 times higher than in the Black community, or for Black residents in comparison to white residents. So there's an equity issue at stake here, and really aligning with the county's policy roadmap, we have a collective effort to reduce health inequities by addressing racial disparities in social, physical, and economic conditions that impact health. So transportation, how we move around our communities, is central to that. Next slide, please. So as I mentioned, we're in the beginning process of this safety action plan, gathering all the needed data to analyze and to identify the strategies, recommendations, policies, resources we're going to recommend be put in place to better support our community residents, especially those that have been historically disadvantaged and impacted by traffic-related fatalities. So with that, we need your support. We need to hear about your personal experiences using Cook County roads we want your support in sharing this information with those in your network, colleagues, friends, families, for them to provide their insights. There's 2 opportunities. I'm going to drop in the chat the engagecmapillinois.gov/cook. That's the website that provides additional information about this planning effort. But then there's also 2 opportunities. There's a brief survey for you to provide some insights. Again, we're looking for your experiences as a biker, as a walker, as a driver, as a public transit user in our region to provide us your insights. And in addition to that brief survey, we also have a map, an interactive map, where you can actually drop some pins on intersections, on areas that you've experienced to be unsafe. So again, once we gather this insight, the survey and this interactive map are open through the end of February. Once we gather this information, it's going to help inform the plan and, like I said, the recommendations we're setting forth for the county, but then also statewide. Are there policy changes that we're looking to implement to improve safety on our roadways, and to really protect pedestrians, bikers, and walkers in our communities? So again, your insights will help inform the recommendations and the plan that we put in place. And once this plan is complete, it opens up funding and resources for the communities to put these safeguards in place as well to better address the needs of our communities. So we really appreciate your support. I'll drop in the chat right now these additional resources. Thank you. And if there's any questions, feel free to drop them in the chat. I'll stay on to help address anything.
Thanks, Amy. Up next, we have a presentation from Mobile Care Foundation from Kamari Thompson.
Hello, everyone. Can you hear me?
Yes.
Okay, perfect. Thank you. Happy Friday. Happy Good Weather Friday. And I will start into our presentation. So and let me turn on my camera so that you are able to see my face. Okay, so my name is Kamari Thompson. I am the Director of Programs here at Mobile Care Chicago. And Mobile Care Chicago is a mobile asthma, allergy, and dental specialty clinics. We service pediatric patients throughout the city of Chicago and surrounding suburbs. And our goal is to be able to do what we can to take needed services into underserved communities to increase health equity around surrounding some of the things that causes the highest rate of ER visits, absenteeism from school, and just overall poor quality of life among the populations and the communities that we serve. So, Mobile Care was founded in 1998 by four pediatricians in the Chicago area. And initially, they wanted to try and figure out what neighborhood would be best to open up this clinic in. They were going to actually open up a clinic, a brick and mortar clinic. And there was so much disparity in so many different neighborhoods that one neighborhood could not be chosen. So they opted to design a mobile program that was based off of a program, I believe, that was out in Los Angeles. And that is how Mobile Care Chicago was born. As I stated, our mission is to deliver no cost medical and preventive care and education to families that need it the most. Can you go to the next slide, please? Um, so, about our clinics, we send our mobile units, and this is a picture of our most recent mobile unit and one of our providers. We send our mobile units, and they are affectionately known as the asthma and allergy vans. Like no one calls us Mobile Care Chicago, but the people like inside. And we go into low income communities, and we provide ongoing support for kids with asthma and allergies. So the key there is definitely that this is ongoing. Um, we don't just see a child once; we see them as often as they need to be seen. We open up our age at like 6 months old. We'll go until 18 years or high school graduation. And we've also very recently, in the more recent years, brought on a provider that can see adult patients. So those young adult patients transitioning into primary care or specialty care in the asthma and allergy space. Next slide, please. Okay. And you'll just see like a bunch of pictures. This is a child getting a physical and kids hanging out on our dental van. You can scroll through the next slides. The next few slides are just pictures of our services. Oh, can you go back? Just one, I'm sorry. So one of the services that we provide is allergy skin testing. And allergy skin testing is done in a way to identify whether or not there are any environmental allergies that the child is allergic to that may be triggering the child's asthma. So all of our patients qualify for allergy skin testing if necessary. The results are that, as you can see, the test is done right on the van, and the results are given to them within about 20 to 30 minutes or before they leave the clinic. Next slide. So when we talk about like impact and results, currently on the asthma side, we have, and this information is actually from a previous fiscal year, so it's I'm sure has gone up a bit, but oh, I'm sorry, back one more. Yes, right there. So about 1,000 active patients, and over that amount of active patients, about 2,500 patient visits. Again, this has a lot to do with the fact that we see patients more than once. Average number of times a patient comes through our clinic is about 3 to 4 times a year, or like every 3 or so months. That can definitely be more or less depending on the severity and the control of the child's asthma and allergies. 97% of our patients after enrollment report no ER visits for asthma related illnesses. And no asthma related, 98% report no asthma related hospitalizations, and 100% of our patients are either at or below the national average for asthma related school absenteeism. So every patient that comes into our program actually reports that they are having less missed days of school due to asthma or allergy symptoms. Next slide, please. So when we talk about disease prevalence, like how prevalent is asthma, and how much of a disparity is there in receiving care? So if you look at these two categories, if we're talking about East Chicago, and those of you who are familiar, East Chicago is on the far east side, southeast side of Chicago, right on the border of Indiana. And there were 352 asthma hospitalizations, um, over 1,000 ED visits, and 25% prevalence of asthma, in 25% prevalence of asthma, but not a single allergist in that area. When you compare that to Lincoln Park, the numbers drastically go up in the incidence rate and down in the prevalence rate. So 56 asthma hospitalizations, 111 ER visits, but less than 6% of asthma prevalence. And they also have three of the top allergy practices within 1 mile of the area. So when we talk about impact and need, it is very important that mobile care continues to be able to provide this service and go to the most underserved areas in the city of Chicago. Okay, next one, please. We talked about skin testing. This is just a picture of a cute kid waiting to get the results of his skin test. And he looks like he is, and if he's looking over to the side, because we usually try and distract the kids by having them watch a video on the tablet or phone. So it's a cute kid with skin testing. Okay, can we go to the next slide? More skin testing. And what you will see here is someone holding a tablet, because we want to be able to provide care as much as we can without and eliminate barriers. Sometimes we are faced with the fact that our parents are not able to show up. They have work, they have other obligations, and that's why we have a thing called telehealth or virtual visits. And you'll see that there is a mom on this screen, and she is attending her child's visit virtually. Next slide, please. So that kind of concludes my presentation. If you guys are interested in reaching out to me, my email is there. You want to visit our website, it is below, mobilecarechicago.org. And this is just a cute picture of a child making the asthma van into a fairy. So, guys have any questions? I'll take them now. Okay, thank you.
Thanks, Kamari.
You're welcome.
Okay. Up next, we have um, FELA, Freedom Human Trafficking Prevention. Before we move on to the next presenter, they requested that we do not record the. Unfortunately, we will not be able to record this portion of the presentation. However, you will get a informational fact sheet in the newsletter.
And what was really shocking to me is that, we hear the words trafficking, and sometimes we get this idea in our minds that folks are like, children are like taken, and that can happen too. But what one of those videos that Cassandra pointed out did for me is open my eyes about, Cassandra, I don't know, I forgot what you call it, like that friendship part where the friend is really prepping his friend or her friend to be caught up in a situation. And so I just really think for adults that may be out the loop, like myself, was completely out the loop. This is a wonderful way through video. It was, when they showed the video, they did warn you it was very sensitive information, but it was great because you got a, first hands view to see what trafficking looks like in the real world, and youth's involvement in it. So that's what, if anything that I took away, it was that. And I encourage any of the educators, like the social workers at ACTS, to learn more, and for our parents to be aware as well. So I just wanted to share that. Thank you.
Thank you, April. Okay. Anyone else have any questions about any of the content that was shared in the school health meeting? Okay. Okay, now we're going to be closing out the meeting. Before we close out the meeting, I just want to let you know that the next registration for the next school health meeting for next month on the 21st the link is here, and it will also be provided the link in the school newsletter. If you have not signed up to receive the school newsletter, um, you can sign up to receive the school newsletter on the school health web page, and it's also in the chat. Okay, we have a question from Maria Elena.
Yeah, hi. I just want to say that I have a resource guide that I just put, it's live today. It's on navigating immigration resources. So I put it in the chat if anybody wants to utilize it and use it because it's important information.
Yeah, it's great. Thanks. Thank you for the community. Thank you, and we will add this to the school health newsletter. Andre, you still have a question? You, Sandra has a question. Cassandra, did you have a question? No. Okay. Okay. Thank you. And the slide deck will also be available too on the school webpage, and also the recording of the meeting will be uploaded as well. So we will get a newsletter right after the newsletter on next week, right after the meeting, with all of the recap of the school health meeting. Okay.
You might have talked about this already. Are they having a school health conference this year?
No. No. Okay. Happy New Year to everyone, and enjoy the rest of your day, and enjoy the weekend, and also enjoy the because it's a holiday weekend, so enjoy that too. Okay, take care, everyone.
Thank
Have
you.
a-
Happy MLK weekend. Thank you, Stacy and Marsha and team. Thank you.
Bye.